Good.
Graft-versus-host disease, or GVHD, is a rare disease that commonly impacts allogeneic blood and marrow transplant recipients. Living with GVHD can be overwhelming for patients as well as their caregivers and family. Now, joining us now to bring awareness to this rare condition is Dr. Corey Cutler and GVHD patient Meredith Cowden. Good morning to both of you.
Good morning.
Morning.
Morning. Dr. Cutler, what is graft-versus-host disease?
Graft-versus-host disease is a medical condition that occurs after stem cell or bone marrow transplant. When we do a bone marrow transplant, we're transplanting a new immune system into the recipient. That immune system's job is to recognize things that it thinks are foreign. And in fact, when we transplant this immune system, everything is foreign because it finds itself in a body where it doesn't belong. And so GVHD is a reaction where the transplanted graft reacts against the host and essentially causes rejection. Now, GVHD can affect any organ system, with the skin, the mouth, the eyes, the liver being the most common, but no two patients have the same manifestations, and most patients have a variety of different organ manifestations over the course of their disease. It can ebb and flow in terms of severity or even presence or absence, so no two patients have the same experience with GVHD.
Now, doctor, who does the disease impact and how?
So it will impact some proportion of stem cell transplant survivors. There are some transplant recipients who get no graft-versus-host disease, and there are a small proportion that get severe GVHD. But overall, somewhere between a third and a half of stem cell transplant recipients will eventually get some degree of graft-versus-host disease. We're working on ways to prevent it better, and we're getting there, but there are still a number of patients out there who are dealing with the daily effects of GVHD on their life.
And speaking of patients, Meredith, tell us about your journey with GVHD.
Yeah, thanks for asking. It started when I was 19 years old and I developed leukemia. And so then I had a bone marrow transplant with my sister as my donor. So we were like, this is great. It's going to go really well. And then I developed, as Dr. Cutler was talking about, I developed a rash. And so then that led to, it was acute graft-versus-host disease, and then it moved into chronic graft-versus-host disease. And so for the last 20 plus years, I've dealt with various manifestations throughout my body. And, it's moved from my skin to my eyes, to my mouth, to my stomach and gut, kidney, and now it's, in my lungs and also my musculoskeletal system. So it's really, it changes, it morphs, it just is sort of just this ever-changing thing that's going on, and it's always a surprise, I'll put it that way.
How are you living with this?
I'm sorry?
How are you living with this?
Oh, how am I? Okay. Yeah, thank you for clearing that. So I'm, I do what I need to do, and, I have various different, methods and stuff. I do everything that I can to take good care of myself. I try to eat as healthy as I can. I exercise, and I have a really great relationship with my treatment team. And, we work together on this because it's something that it takes a village. It's not a one-person illness. It involves a whole community, including family and friends and partners and, professionals and everyone. And so it's something that everybody works together on.
Speaking of working together, what is the best way, Meredith, to advocate for someone with this disease?
I always learning as much as you can, gathering information, trying to find out what you can so that you can best identify within yourself, what's different, what's going on, is this a symptom that I'm having? And so, we have the GVHD Alliance, and there's a website, GVHDalliance.org, and that's a place that has a ton of resources for not only patients, but caregivers, community providers, family, and there are lists of symptoms. There's information about acute GVHD, chronic GVHD, a list of providers. There's, as all of the information that you can possibly gather. And so that's a really great way for people to learn as much as they can about this illness for themselves or loved ones or patients.
Dr. Cutler, tell us about GVHD Day and what is the major takeaway you want people to remember about this condition?
That's correct. We're having GVHD on February 17th this year. It's a day where we can bring patients, families, caregivers, and GVHD providers together in one physical space to really talk about the condition and to raise further awareness. Again, our goal here is really to point patients in the right direction early in their illness so that they can seek out appropriate treatment at a transplant center and really end up with better outcomes. All that information is again on our website, gvhdalliance.org. There's something for everybody there, be it a patient, a caregiver, or a community provider physician who may not be so familiar with the disease.
Dr. Cutler and Meredith, thank you so much for joining us on Morning Blend. And Meredith, you surprised me that you're just kind of hanging in there. It's just like an everyday thing for you now, isn't it?
It is, yeah. Thank you so much.
Thank you for joining us. Thank you again.